I've cared for hundreds of patients. Some I remember for their strength, others for their stories, but one I remember because he shattered my assumptions. Mr. Taymor was 61 years old. His chart was thick with history: COPD, hypertension, diabetes, and now a newly diagnosed lung mass. He came in gasping, irritable, coughing blood, and clearly in pain. I took one look at him, angry, unshaven, yelling at staff, and quietly labeled him difficult. He refused to keep his oxygen on. He cursed when we repositioned him. He wouldn't let anyone near his fourth site. As the nurse on shift, I felt exhausted before the night even began. I stayed polite, professional, but inside, I was already shutting down emotionally. Until I found him crying. It was 2:00 a.m. The unit was dim. I had gone in to check vitals and noticed the curtain pulled. I peeked in, ready to scold him again for removing his oxygen, when I saw something different. No defiance, no anger, just a frail old man with silent tears running down his face. He didn't notice me at first. He was staring at a small photo in his hand. I softly asked, "Sir, are you okay?" He wiped his face quickly and said, "I'm not angry, I'm just scared." He held up the photo. A young woman, maybe in her 30s, my daughter. She died last year, cancer. I was her caretaker until the end. He looked down at his shaking hands. Now I'm the patient, and I hate it. I sat beside him, suddenly ashamed of every judgment I had made. In nursing, we learn to assess our way: breathing, circulation, behavior, but we often forget that behavior has history. Pain doesn't always look like weakness. Fear doesn't always sound like a whisper. Sometimes it yells. We talked for 15 minutes about his daughter, about death, about how lonely it is to be a man who once carried everyone, now needing help to walk to the bathroom. He didn't need morphine at that moment. He needed to be seen. From that night on, he changed. Or maybe I did. He still grumbled, still resisted sometimes, but I met him differently, and he met me back with trust. Before discharge, he gave me a note. It read, "Thank you for treating me like a person, not a problem." I've kept that note in my locker ever since, because I almost missed the chance to really see him. And if I had, I would have missed one of the most important lessons of my career. Learning lessons for healthcare workers. Difficult patients often carry invisible pain. Look deeper before labeling. Emotional presence is just as important as clinical skill. You don't always need to fix someone's. Sometimes, you just need to listen. Learning lessons from medical and nursing students. Behavior is a symptom, too. Learn to read between the lines. Slow down long enough to connect. Even 1 minute of compassion can shift a patient's entire experience. Judgment is easy. Empathy takes effort, and it matters more. Learning lessons for the public. Patients are people, not just I. Behind every harsh word might be fear, trauma, or heartbreak. Treat caregivers and healthcare workers with patience. They carry a lot behind their calm faces. The smallest acts of kindness in a hospital can echo far beyond discharge. Closing reflection. That night, I learned that difficult patients are often just hurting in ways we can't see. Mr. Taymor reminded me that behavior is not the whole story. Sometimes anger is grief in disguise, and resistance is fear asking to be understood. In healthcare, the greatest shift happens when we stop treating people like problems and start seeing them as human. This is Silent Scrubs, where every story carries a lesson for healthcare workers, students, and the public. If this story touched you, subscribe and join me as we uncover the unseen truths of hospital life.